Hello, and welcome to another edition of News Nightly. I am your host, Scarlett Johansson, and today's episode will be on kleptomania. Kleptomania is something that has perplexed psychologists for years. Some claim it's not real, while others say it's something that's just not like general. We have here Dr. Leroy von Winkelstein and his patient who is actually dealing with his kleptomaniac symptoms. Hello. What exactly is kleptomania?
Well, you'll see, kleptomania is the repetitive, uncontrollable stealing of items that are not needed for personal use. It usually goes unrecognized in regular practice.
When was kleptomania first diagnosed?
The idea that people might not be able to control their stealing was first examined in 1838. It first appeared in a statistical manual of mental disorder in 1952, but as an impulse control disorder. It was unclear when exactly it was first diagnosed.
How is kleptomania diagnosed or distinguished?
It can be distinguished by 4 different signs. 1. Cannot resist impulses to steal objects that are not needed. 2. Tension immediately before stealing. 3. Pleasure gratification or relief at time of theft. And 4. Most crimes are not committed to express anger.
What can you tell us about your disorder?
I rarely steal items of value. I only take the small items that mean absolutely nothing.
Then why steal?
I have no idea. I just get an anxious impulse in me, and I just have to take something from one of my friends, or even family members. Once I do, the impulse that guided me to steal something, I just feel better about myself. I don't know why.
What do you do with these items after you steal them?
Well, I usually throw it away. Sometimes I keep the items if I like it or not. Sometimes I'll give them away, and sometimes I'll return it, and they never even know it was gone.
Do you ever feel guilty?
Yeah, I feel guilty all the time. At first, the feeling is pretty small, because when I finally steal something, but after a while of stealing tons of different stuff, it starts building up on you, and you don't even know what's going on anymore. And then you realize that you have all these things that you don't even need, and it's horrible. I feel like a horrible person.
What age do people start to show symptoms?
People normally start to show symptoms around the age of 4 and can get to about 77 years old. Most of the patients we see are women because they are more likely to go for evaluation.
Why isn't kleptomania considered shoplifting?
The reason that kleptomaniacs are not considered shoplifters is because shoplifters steal for personal gain, while kleptomaniacs do not. They tend not to use the items at all.
What are the treatments for kleptomania?
Well, initial medication use was serotonin like fluoxetine. The main treatment, though, is therapy. Cognitive behavioral therapy is the main type.
Can you please tell us what happens in your therapy sessions?
Well, the doctor tells me to imagine stealing, then a negative outcome. I usually think of getting caught or being sick afterwards. Sometimes we practice aversion techniques. I hold my breath every time I want to steal.
Come in.
How you doing, Dana?
Good. How are you, Glenn?
Nothing much. Just walking around.
Really?
Yep. What have you been up to?
Actually, you'll never guess. I was on Wikipedia looking up this religion called Pastafarian.
Pastafarian?
Yeah. It's like they pray to the flying meatball monster. I'll show you. It's so funny.
Okay.
I'm not even joking. It's
Really?
real. Yeah.
Really, that's definitely something. You know, I have to get going right now. Can you show me it later?
No. Bye.
You're not,
Nice
Bye.
seeing you. Bye.
you're fine. See you later.
Maybe.
Lucy, what's up?
Not much, how are you?
Nothing much. What are you up to?
Homework. It's kind
Homework.
of boring. Yeah, I know.
Really?
Yeah, I know. What are you up to?
Nothing much. I just want to stop by and come talk to you.
Oh, good. Great.
Yeah.
Well, it's nice to see you.
It's nice to see you too.
Good. So, what are you going? Do you have your homework?
Yeah, I have like psych stuff right now.
Okay.
It's work.
Okay.
It's work.
Well, try and have fun.
I try. I try every day. Every day of my life I try and have fun, but
Okay.
it's busy,
Good.
as always.
Working hard.
Working hard. Or hardly working.
Or hardly working.
Exactly.
Word.
I
All
know.
right.
Oh yeah. I'll see you later.
Bye.
Adios.
Okay. Hello, and welcome to another edition of News Nightly. I am your host, Scarlett Johansson.
And your host?
Start over.
I forgot who I was.
That's a terrible thing.
That's a horrible thing. I think you have a problem
Here
too.
we have the doctor's name and Glenn's name.
Dr. Leroy von Finkelstein.
Dr. Von
Leroy
Frankenstein.
von
Dr. Leroy
Wait.
Leroy
Okay,
von
okay.
Finkelstein. Wrinklestein. Go.
We have
Wait,
here
can you change
Dr.
it to
Leroy. Okay, wait.
Yeah.
Silence.
That can be Glenn's name.
Silence. Silence.
Okay.
Silence. I'll kill you.
I kill you.
I kill you!
I can't.
We're getting this from
Wait, don't stop recording. Don't stop recording because I want to save that.
I kill you!
You guys know that? You guys seen it?
Yeah, of course. Jeff Dunham.
Yes!
I know.
I kill you!
I kill you.
Okay. When was kleptomania first diagnosed?
Last year.
What can you tell us about your disorder?
It sucks.
That is great. I steal.
Wait, go again.
Then why steal?
Because I like it.
We can describe that.
Why would you
Please.
steal?
I like the taste.